So it says it's recording. All right, so I wanted to go over some parts. We'll start in chapter 7 on the skeleton. So I think what we'll do is we'll start it from cranium or the skull down. And there's a lot to learn here, but as we're learning it, try to think about these markings, what might attach to them, if there's a foramen or a meatus or some kind of opening, you know, what is it for? Is it for arterial? Is it for a vein? Is it for a cranial nerve? And remember too, and I'll try to mention it again, the cranial nerves are numbered 1 through 12 from superior to inferior. All right, starting with cranial nerve 1, all right, for smell. And then ending with cranial nerve 12, hypoglossal for the tongue and some of the, yeah, for right now, just most of the tongue and some of the neck muscles, but right now we'll just say for the tongue. I'm sorry, it is just for the tongue, sorry. It's motor only, okay? So the skeletal system or skeleton is composed of bones, cartilage, joints, ligaments. So remember, cartilage, we have cartilage like in the temporal mandibular joint. That's going to be for articulation. We want it's coming up a smooth surface. So this can glide or motion. And, you know, we need those joints there. And ligaments, remember, ligaments join bone to bone. Tendons join muscle to bone. Right? So the skeletal system or skeleton is mostly bone. Cartilage occurs at isolated areas. Like there's costal cartilage. There's cartilage in your intervertebral joints. Ligaments connect bones and reinforce joints. And remember too, if you're going into healthcare, once you sprain or strain something, right? If you strain it, there's generally muscle. If you if you sprain it, it's generally ligament. And once these ligaments are stretched, remember the tissues, elastin and all these fibrin tissues, once you stretch them, they don't want to come back to the original shape. So usually there's going to be some instability around that joint or instability around where the bones articulate. So the skeleton accounts for 20% of body mass. And remember, I just, last chapter or so, we were talking about bones. Remember, these are very, very metabolically active. Right, so we're going to divide the two major divisions, the axial skeleton and appendicular. When we talk about appendicular, we talk about appendages. So that would be like your arms and legs, and we'll get into, you know, arm, forearm, thigh, and all those different portions. But right now, just start thinking of your appendages, your arms and legs, right? So, like I said, we'll try not to make a mistake on the video or misspeak. But if I do, if you want, you can go into the YouTube channel and just leave a comment, and I can maybe add another tube chop it or something. Tube chop down. All right, so the axial skeleton, remember this is going to be, you know, down the sagittal plane and midline. All right, the axial skeleton consists of 80 bones divided into 3 major regions. So we're going to talk today about the skull, then we'll go into the vertebral column and then thoracic cage. So the vertebral column is that vertical column, and it's going to encase your spinal cord. So the skull and vertebral column are going to be primarily portions of the osseous tissue that's going to encase the central nervous system. So it'll be your brain and your spinal cord. So the axial skeleton has 3 functions. So it forms longitudinal axis of the body. So that's that longitudinal axis, right? Supports the head, neck, and the trunk. Tremendous amount of weight, right? So think about that. If anyone's gone bowling, all right, so a bowling ball can be anywhere from 8 to, I don't know, 14 pounds or whatever. But that's the weight of your cranium. So your neck has to support all that. And a lot of us walk around with forward head carriage. So our head is going forward, puts a tremendous amount of sprain and strain on your cervical spine, your neck muscles, and that can contribute to, you know, neck pain, shoulder pain, posterior shoulder pain, and just a lot of stress, migraines, and things like that. Right? So it protects the brain, spinal cord, and the thoracic organs. So think of your thoracic organs would be that mid body. So, you know, obviously, we're a heart, lungs, I guess your diaphragm you could put in there. Good Lord. All right, so there's from your book. Here's some of the bones, and I have with me today. I grabbed some skull models. I actually have one real skull model, which is pretty cool because you can't get them anymore. And then I have some plastic colored ones, and then I have an exploded skull, so we pull it all apart. But here's some of the muscle or bones in the body. So just start. When you're memorizing these, just kind of start visualizing what are they articulating with? What are they butting up against? All right, and kind of remember whenever you have bones articulating, generally, not always, there's going to be some kind of cartilaginous tissue there. All right. And we'll get into the details of this after we get the skull, because there's a tremendous amount in the skull. And we're going to learn these bones, and then when you learn about muscles, facial muscles, or muscles of facial expression, a lot of these bony landmarks are going to be where these muscles attach. So when you're studying, take your time. Repetition is key, and start looking these things up, or do a real quick Google search, and realize what do they articulate, or what is that sella turcica? What is that what's going to be sitting in there? I start thinking about all these things because we're going to go over them and over them again and again and again, repetition. So please, as a word of whatever, please don't think that you can just sit down and memorize a couple of sheets of paper and get through A&P. And even if you get through A&P, when you go on to something else, you're going to have to really start applying that. There's going to be some critical thinking. And a lot of students, they lose they're unable to do critical thinking easily because they haven't been training their mind to do it. All right, so get in the practice of doing it. Right. So the skull is most complex bony structure of the body. All right, so when we look at the skull, there's a tremendous, and I mean tremendous amount of bony landmarks in foramen and holes, foramen rotunda, foramen ovale, a lot of these things, and you have to start thinking, well, what the carotid artery has to go through these structures, and your brain's going to sit in there. You've got the different lobes of your brain. You've got the pituitary gland, external acoustic meatus for your ear, and all those nerves that are going for hearing and balance, things like that. So you have to start thinking about this a little bit at a time, and then kind of visualize in 3D how to pull these things together. So the cranial bone or cranium encloses the brain and the cranial cavity, provides sites for attachment of neck and head muscles. All right, and then please also keep in mind, if you guys have me, or if you're taking pathophys or some kind of, when you're going to do neurology or whatever, just realize if there is inflammation or a septic infection in the brain and the dura mater, pia mater, and that fluid, as it expands, it's going to stretch those tissues and cause a lot of pain. But also remember too, if there's some kind of growth or some, we hate to think of brain cancer, some kind of mitotic division of the supportive glial cells or astrocytes or whatever, and it starts growing, there's no place for this to expand to. So it has to, once it hits the cranium, as the mass grows, it's going to be compressing the tissues surrounding it or deep to it. And then we start getting into the brain centers, and not a great thing. Right? So the facial bones, we'll start superficial, and then we'll kind of go to the base of the skull. We'll start going to the superior portion of the skull on the inside, and just start learning some of these landmarks and what attaches to them. All right. So it forms the framework of the face. Contains cavities for special sense organs for your sight, optic nerve, taste for the tongue, hypoglossal, and smell, olfactory, which is cranial nerve 1. Provides opening for air and food passage. So, let's talk about the conchae and the septum. you know, how turbulence of the air and food passage using the tongue and down the esophagus. So it secures the teeth. We're going to learn about the alveolar sockets, the gomphosis, the maxillary bone, or the mandible. Most skull bones are flat and firmly locked together, except for the mandible. All right, so as you look, oh, this is actually the real skull. All right, you can see how thin and more or less, I mean flat by, not flat like that. These are joined by sutures, and I don't know if I can get up close enough to that for you guys. Maybe you can see. Maybe I'll hang on a second. Here. I'll eliminate some of those. Hopefully this will show up on the video. All right. They have a serrated sawtooth appearance, so like a serrated knife, or well, I'm assuming you all know what a saw looks like, right? So there's kind of these squamous sutures, right? And there's coronal, named by the plane it's in, right? Sagittal, transverse, coronal. Remember all those. There's a lambdoidal suture. All right, so that is lambda, Greek letter. That's how they named it. Here's some of your facial bones, maxillary, mandible, TMJ, temporal mandibular joint in there. Facial bones from the anterior aspect of the cranium forming the rest of the skull. Cranium would be the part encasing the brain. Cranium is divided into a vault and a base. Right? Cranial vault, cavera, forms superior. So it'd be your like superior in here. That's the back. Posterior. Superior, lateral, and then if it comes from the posterior portion of the skull, as well as the forehead, or where your frontal lobe is. The cranial base forms the inferior aspect of the skull. Generally, base is divided into 3 steps. We're sort of anterior, middle, and posterior. So just kind of realize what's sitting in that. So anterior is going to be your frontal lobe. Middle is going to be the apparatus for the hearing. Posterior is going to be where your occipital lobe is going to be sitting. Brain sits within these fossa enclosed by a cranial vault. All right, so the area is referred to as a cranial cavity. So I'll just briefly, if I have a skull here, take it off. Oh. All right, so this is anterior, posterior. So if I flip this up, this is still going to be anterior. Anterior here with your frontal lobe, medial, posterior, your occipital lobe. All right, and there is a picture right out of your book. Mr. Galley right there. Middle lobe, posterior. Foramen magnum, all right, means big hole, and that's going to be your spinal cord coming through. Posterior cranial fossa in here. It's going to be where your occipital lobe or the brain is going to be sitting. Okay. There's the anterior cranial fossa for the frontal lobes. And you know, if you look, there's a division here. So we know, or we will learn, that you have a left and right frontal lobe, or you might have heard the term left brain or right brain, depending on which side of the brain you identify with more. Identify with, right? So left brain people generally are going to be very analytical, very science-based. Right brain people generally, you could say they're either musical or creative, much more spatial concepts, all right, in general. Here's a lateral view. We've cut away. So there, once again, there's your frontal lobe. It's going to be your personality, intellect, things like that. And we'll learn this. All right, there's your cerebellum. For balance, occipital lobe is back here. Here's your temporal lobe. All right, so temporal is going to be on the posterior side. And temporal means time. All right, so if you, they named that because men, as they are 40 or older, that area starts graying. Right? So they just, so with time, that grays, they call it the temporal lobe. Right? So just kind of get orientated, anterior, posterior, and a general idea of what's going on. There'll be sulci in here. And realize too, there's going to be cerebral spinal fluid floating all around in here. Cranium also contains other cavities, middle and internal ear cavities. That's going to be in the middle portion of that. The nasal cavity, and we'll see that from the anterior. All right. And orbits that house the eye balls or eye sockets. All right. Skull is 85 named openings. Don't worry, you have to know them all. All right. Foramina, canals, and fissures. So these are going to be openings. Foramina are usually tiny. Fissures are generally not round. They're going to be more oval in general. All right. Provide passage for a spinal cord, major blood vessels, and the 12 cranial nerves. And once again, when you start learning these cranial nerves, we're going to back up. Right? They're going to be named from superior to inferior, ending with cranial nerve 12 here, cranial nerve 1 here for olfactory. So just keep that in mind. It'll make learning them a little easier. All right, so here's your cranial cavity, orbit for the eye. You see these are bilateral, and your oral cavity. All right, so we're going to start learning all of these structures or names of these components. So the cranium is composed of 8 cranial bones. All right, so luckily we have some of these that I ordered for us. All right, these are all going to be, or they are all color coded. Reminds me of, you guys know who Ahmed is? Jeff Dunham? Yeah, so funny. Right. So the frontal bone, parietal bones, remember those are bilateral. And so we only have one frontal, we have bilateral parietal bones. Occipital bone is going to be on the back here. It's going to be covering the occipital lobe. Cerebellum is going to be down here. Temporal bones, right, temporal, remember it means time. That's where men gray. Usually, all right, sphenoid bone. We'll be looking at it here in ethmoid. All right, so you know, I mean, you may have heard of the sphenoid sinuses or ethmoid sinuses and the components of that bony area. So the frontal bone, you know, if you want to say like somebody had a frontal lobotomy, which was not a good thing, but they would go in, drill in there, and they just kind of take a probe and move it all around. It completely changed people's personalities. Right. So the frontal bone is shell-shaped bone, forms anterior and posterior cranium. The vertical part called the squamous region is also known as the forehead. Right. And you know, we talked about squamous cells, but these are usually, they mean like scale-like or tile-like. Right? So when they named it, I can show you guys here. Maybe I'll do that. Would be up in here. I'm actually transluminating a real skull. You can see how thin that is because the light's going right through it. The inferior portion ends at the supraorbital margin, so supraorbital. All right, supra means always above. This is the orbital, so supraorbital. Oh, good Lord. So there's your orbital. So supraorbital would be above the eye. Area underneath the eyebrow forms the superior wall of the orbits and most of the anterior cranial fossa. Right, so anterior. Right. So the supraorbital foramen allows supraorbital artery to nerve to pass through the forehead. This one, I don't see it. Ah, beautiful. So I will try to see if I can drop this thing. Let's see. They're literally right here. I could literally, if I wanted to, put my pipe cleaner right through that. Oh my God, I did. So I did have a pipe cleaner right through. This is a real skull. I have the pipe cleaner right through that. The glabella, I'll use this one. Glabella is right here, the area of the frontal bone between the orbits. Frontal sinuses are located just lateral to the glabella. Your frontal sinuses here. And I guess I don't know if I could. Yeah, maybe I won't. But that's also, you know, some people, spiritual people have that dotted. All right, it's right over the third eye. All right, if you are interested in any of that stuff. And posterior to that's going to be the pituitary gland directly in line with that. So this will keep popping up. So just start looking at this, and you know, obviously your patient's not going to have color-coded bones, but just kind of getting an idea of where these boundaries are and what, you know, optic canal, what's going through there. Well, I would think it's going right to the eye. All right, so the optic nerve, cranial nerve 2 is going to go through there, superior orbital fissure. So we have to innervate the eye, right? So we're going to have some blood vessels and things like that. So as you're going through here, look at your book and start, it'll tell you what's going through it, and then think, well, yeah, we have to innervate that. We have to get blood to it. We have to move blood away from it. A lot of nerve roots and things like that. Our nerves are going to be going through there. So here is a superior to inferior view, S to I, just showing you some of these components. There's a cribriform foramen, optic canal, all right, foramen ovale, spinosum. My phone is right here. So this is going to be some cranial nerves going in here, through here. All right, internal acoustic meatus. So this would have to do with something with the ear, right? So if you're talking about, you know, think, well, what cranial nerve innervates the ear? All right. So I'm not going to tell you that. You can look it up, and then you'll remember. All right, so just start thinking of, you know, why do they name these landmarks, these certain things? There's a hypoglossal canal for cranial nerve 12. All right, it's going to innervate your tongue, tongue muscles. And here's a view from, that looks pretty much like a real skull, actually. I can tell because it's so thin. Yeah, it's so thin. All right, and the other thing is here, and I showed you on the other skull here. Just think about this for a second. I'm going to transilluminate that. So I have a pen light. I'm going to go through the eye socket and see how thin that is. And some of these membranes are super thin. So you had a systemic infection in your bloodstream. All right, if there was enough pressure, it could just go through that, or if enough pressure, it would actually break that very thin membrane. You could get that systemic infection into the cerebrospinal fluid, and that can cause some major problems. Because antibiotics, it's a little harder to get antibiotics into the cerebrospinal fluid. Just like with meningitis, right? It's inflammation of the meninges, and that can be life-threatening in a matter of hours. All right, so, you know, start learning the signs of that. You know, people would be telling you it came on super sudden, the most intense headache they've ever had in their life. They're going to be in Kernig position with their knees flexed. You go to straighten them out, they're going to be in a lot of pain. Because they want to take all the pressure off that, the dura mater, pia mater, and the spinal cord, because there's so much pressure building up in it. They're expanding that, causing the headache. All right, and if you go to straighten out, you're putting more tension on that. Very painful. Telltale sign. Right. The two parietal bones form most of the superior and lateral aspects of the cranial vault. Right. There's 4 sutures. Remember, those are going to be the saw-like structures, right, where these bones come together. Right. Let's get rid of the parietal bone, the frontal, occipital, and temporal bones. All right. Coronal. All right. So depending on the orientation of the bones, or something more coronal. Well, what kind of section was that when we were talking about that in chapter 1? All right, sagittal, right, between the right and left. So sagittal, like a sagittal plane. Coronal, realize the orientation of that. Lambdoidal, between the parietal and occipital bone. And remember, we set that lambdoidal shape in the Greek letter. And squamous, sutures are between the parietal and temporal bones on each side. Right. So these names will give you landmarks or give you a hint as to where they're located. Right. So there's coronal, there's the squamous, all right, and there's lambdoidal, just by the shape of it. Okay. There's a sagittal, like the sagittal plane. So, all right, so you have to think, well, wait a minute, is this anterior or posterior? Well, this is actually posterior. Posterior, look, from P to A, posterior to anterior. There's your occipital condyle. All right, this is how your skull is going to articulate with C1s for cervical vertebrae. External occipital crest. So there's going to be attachments for a lot of these neck muscles, or the ligament nuchae. There's muscles that attach to keep your eyes on the horizon. It's called the Reuting reflex. Keeps your eyes completely at the 180 on the horizon. So depending on your posture, how you're walking, or curvature of your spine, or if you're supinated or pronated, anything, so your eyes always want to be on the horizon. So they will do whatever it takes to keep that, it's like a balance, a navigation system, keeping your eyes level. Good grief. So here is similar to what I have here. It's similar, just colored differently. All right. The view of the skull from the lateral aspect. And there's one on the, that looks to be real. Yeah. Wow, that's awesome. That is. Now we've taken the same skull and we've done a sagittal cut on this, and it'll show you right here. If you're not sure, like, well, that looks weird, or I'm new to this, and what the hell did they just do there? Just go and look. They'll show you, it looks like a piece of glass, they're cutting it right in half for you, midline. So now you're getting a view. So theoretically, the mirror of that would be on the other side. So just realize, well, you guys kind of know, well, my ear's over here somewhere. And you know, we have to have internal acoustic meatus. Meatus is whole, right? Acoustic, well, it sounds like sound to me, right? So just realize that this may be, you know, for, just think, well, what is it for sound, or is it for the cranial nerve? And just go in and read up on that. Right? Cell turcica, is on the sphenoid side of cell turcica, means Turkish saddle, and there's going to be a very, very important endocrine organ sitting in there. All right, so if you do a radiograph or an x-ray and that's diminished or not there, you have something called empty saddle syndrome, all right? So think about this. So actually, I'll tell you right now, the pituitary gland sits in there. So if your pituitary gland is atrophied, it's not going to be, you know, if they find this in an infant or an adult, something that could be cancerous or something, that can be very, very devastating. Right? And if it's an infant, it's not sustainable with life, failure to thrive. If it's an adult, they're going to have major, major endocrine disruptions. So they may be on endocrine therapy the rest of their life if they can correctly figure out what the problem is. Right? Occipital bone is going to be the most posterior, superior to the cerebellum. Forms most of the skull's posterior wall and posterior cranial fossa. Articulates with the parietal, temporal, and sphenoid bones. So it's just saying, you know, what is it articulated with? So you can see here, oh, sorry, in the color, what is it articulating with? Right? What is it brushing up against? So if it was a country or a state, what would be its borders? What would it be butting up against? Articulations. Foramen magnum is large hole. Right, so there is the foramen magnum. All right, where the brain connects to the spinal cord, flanked by a pair of occipital condyles. Right. Here and here, This is what sits on your spine and allows you to nod your head. Yes. So it's going to be kind of like an egg on a spoon. It has this rotational glide to it. All right. The hypoglossal canal allows cranial nerve 12 to pass through. And remember, I said they go from superior to inferior. So cranial nerve 12 is going to be all the way at the very, very base or bottom, and that's going to articulate your tongue muscles. And once again, it's purely motor. So some of these cranial nerves are sensory and motor. So sensory means they're gonna have receptors for something very, very specific. Some of them are strictly for motor skills. So your brain's the homunculus is gonna send a brain signal down through those cranial nerves to these muscles to get them to formulate or formulate or control swallowing, organize control of swallowing, orchestrate, yeah, okay. External occipital protuberance, all right. Protrusion just superior to the foramen magnum. So literally it's right here. This painting is, I hope I don't have any paint on my nails. All right, so right there, all right. Ridges that are cyphered with the ligament nuchae. So that ligament, nuchae is neck. So it's going to attach ligaments there. All right. So if you've ever seen like some mammals or mother cats, when they pick their kittens up, they pick them up from the back of the neck. It's very, very durable attachment. They pick them up from the ligament nuchae. Superior and inferior nuchal lines, site of attachment of many neck and back muscles. So many of these neck muscles are going to attach here in the back muscles to control the movement of your head. And like I said, for that writing reflex, keep your eyes on the horizon. Right? So a lot of people that have, or most of the population, I would say now, because of our cell phones and computers and tablets and just the way we operate now, they're going to have a lot of sprain and strain on here and a lot of hypertonic, so overly tense muscles, because they're constantly being used. And a lot of us or people don't know how to relax. So unless you're going in for a massage or whatever and just kind of consciously relaxing those muscles, they just stay contracted. When we start talking about the cross bridge theory later on, we'll go into hypertonicity and things like that. And so here is your posterior view again. So superior nuchal line. All right, so this is the superior above. All right, here's your inferior. Right. So this is going to be where a lot of those neck muscles or strap muscles attach. Okay, so if you haven't figured it out right now, this is from inferior to superior. All right, so we're looking from your palate up, right? But what's missing is this guy, the mandible. They're taking the mandible off. So it would be this view, but with this removed. I really want to remove that. Okay. A lot of the students remove this, and then I have to go and replace the springs on them. It's actually quite annoying. All right, so just kind of go in and look at these. This is really, honestly, this is more of a lab exercise, but I'm going to cover it in lecture and pop this into lab because I can't be sure that if you don't have lab with me that this stuff is covered. I really thoroughly think that your lecture and lab should be they should work synergistically together. Right? Shouldn't really be completely separate, but sometimes labs are full or lectures full and you have to jump in somewhere else. All right, so when you're learning these, I'm going to ask you to, or just suggest possibly, that you take the extra minute. Like I said, you guys, I mean guys and girls, have the ability to go in and Google search this. When I learned all this back before some of you were probably born, we had to literally go in, and if we didn't know what it was, we had to go to the index, find that page, and then search for it. Very, very time consuming. So you literally can go in, you can Google search. So you can study on one thing or have your cell phone and your tablet or your laptop or whatever you're doing and just go back and forth. And just the fact that you're typing it in, you're going to kind of learn the spelling and it's going to bring it up. You can get another picture of it or another description of the same thing. It'll give you another image to capture in your head so you can remember that in the future. Right? So there's a difference between colored and plain. All right. So we were lucky in grad school, we literally had all real bones, all real skulls, real, actually real human brains. So we got to look at all that really cool stuff. So the temporal, remember I said temporal means time. So start thinking about what with me where I'm graying in here. Paired bones that make up inferior, lateral. So what does that word mean? Inferior means lower, lateral means side. Aspects of the skull and parts of the cranial base. And the other thing I want to remind you just popped in my head. When you are looking at this or researching it, read it very slowly. What are they saying? Or if you don't know a word, just literally Google it and figure it out, because these words can pop up again, or when you're taking a board exam or NCLEX or something that's really, really important, you don't want to have a brain freeze and go, oh my God, what does that mean? I can't remember. Well, you can figure it out if you look at the word and break it apart. All right, so, you know, and if in your book, if you have something italicized or whatever, look in the margins, it'll tell you, you know, it's Greek or Latin or Hebrew or whatever. Where did that name come from? Because they'll use these same prefixes or postfixes later on. So you can always figure out it has something to do with something. Right. So squamous, zygomatic process, right, it's going to be coming around the side of the face. Right. Articulates with the zygomatic bone to form the zygomatic arch and the mandibular fossa. So look at that. So there's going to be, you know, here it's all color-coded. It'll be like the zygomatic arch, zygomatic bone. So as the temporal and the zygomatic come together, they're going to name that joint one certain thing. So go in and kind of figure out what the name means, or the area. The name will tell you the area. It'll pinpoint the area. So let's say somebody was, you know, God forbid, in a car accident or fell or something, and they broke part of this. You would know exactly what they said. Well, they broke the zygomatic arch, wherever. They gave you a directional term or a measurement. You kind of know where it happened. And there's your temporal mandibular joint, TMJ. People have a problem with that. Right. Tympanic, all right, this surround the external auditory meatus. Right. So there's your ear. All right. Tympanic is the area all the way around this. All right. All the way around that. All right. And you say, well, I don't know what that means. Well, the tympanic membrane is your, well, you used to call it your eardrum. Now you're going to call it the tympanic membrane, right, which vibrates and moves all those anvil, hammer, all those incus, all of those bones of the ear to translate all that, the sound waves to nerve impulses. So the petrous houses the middle and internal ear cavities. I'll try to do this here. So this thing, I say this is the petrous portion. So this is superior to inferior. Brain's laying on this, and here's your petrous portion of that. It's very, very rigid. Very, very peaked. So there's a lot of attachments. So also remember too, your brain is encased in that dura mater, that means tough mother. It is going to have attachment sites to the skull. Several foramina. Remember, those are the holes penetrate the petrous portion. So there'll be holes in there. And you can probably see some of them. If you try to maybe transilluminate them. Thank God I went to the EMT department. Thank God they had this pen light on me. So you can probably see some of these holes in here. Right. So the jugular foramen allows passage of 3 cranial nerves. All right. Now also, what do you think? What else? You can actually go on the jugular foramen, the jugular artery. All right. Carotid canal, passage for the internal carotid artery. Foramen posterior. Okay. And internal acoustic meatus. All right. Stylomastoid foramen. Cranial nerve passage. All right. So here's your. God, this is beautiful. So I get excited. I don't know if you guys can see that. I'm illuminating it. I'll illuminate this one. Maybe from the side I can do it. There's like a styloid, a little bony process in there, right there. The styloid process. All right, so, or maybe you've seen a stylus for a tablet, or back in the day, there's one alive in the 70s and early, well, even 80s and 90s, we had record players, LPs, and there'd be a stylus in there that would go in there. But the stylus and the human body is for the attachment of the tongue muscles. All right, and the hypoglossal nerve goes through there, cranial nerve 12. It's going to innervate those tongue muscles. So there's a lateral view right in there. There's a styloid process. And then just imagine your tongue is in this area too. All right, so if you were going to rip someone's tongue out, all right, that sounds horrible. All right, if you were to pull on that, there's going to be attachment sites here too, the muscles, tongue. All right. So there's in the picture. Okay, and then there's a temporal bone. All right, so I brought this guy here. So this would be the temporal bone if we were separating it. So there's the temporal bone. So just if we're studying that bone separately, you know, we're not going to do that obviously because your guys aren't physically here in lab. But there's your external auditory meatus, so it gives you a point, a reference point, all right? And then just realize when your ear down, your tongue is right there too. So you kind of can get an idea. So if you were, well, I guess, even if you were quizzed on this or tested on this and someone had, you know, back in the day, we'd literally have a pipe cleaner through the, you know, we'd have a pipe cleaner through that external auditory meatus, and then we'd ask you, you know, if we pointed to this too, we'd say, well, what is this? You have to know this is the temporal bone. That's the external part of the ear. Below that is the tongue. So you'd say, well, what would attach to the styloid? So the muscles of the tongue. Okay, perfect. Then once again, there is view inferior to superior, and there's your palatine bone, right, in this area here. So if you don't remember that well, think of your taste palate, and that's your palate, right? And the maxilla, right? So a lot of you probably have burned this, right? Drinking something hot or eating something really, really hot, right? And then as you're going through here, just think about if there's nerves going through here and you've ever been to the dentist, you know, they're open wide and they stab a needle in there and they numb these nerves. And these nerves are what can innervate your teeth. So when they do procedures on your teeth, luckily you don't feel it, right? So just start learning some of these holes and orientate yourself and figure out what's going through there, right? I said you don't have to, for right now, know what nerve goes through here per se, but at some point you're going to have to, hopefully, if you have a good professor, that they're going to have you memorize the cranial nerves, all right? And generally what they do. I wouldn't expect you to memorize everything they do, but if there's a sensory or motor function, you probably should start learning it now and getting familiar with it. And if you're like me, sometimes there's that one or two cranial nerves that no matter how many times you pound your head into it, you just literally forget it or don't remember it. So don't get frustrated. And if you don't remember it, it's just start using process of elimination. Well, I know it's not 7 or 6 or whatever, and I know it's not this, so it has to be, and you'll be able to figure it out. I'm going to start looking at some of the structures looking down at the skull. And remember, once again, your brain is sitting in this. All right, so just realize anterior, posterior, what's sitting in here, you know, what are some of these functions here? All right, so clinically, the mastoid process contains cavities or sinuses called mastoid air cells. All right, so realize they're taking up space. We have these air cells in here. All right, if they were completely full of osseous tissue, it would be very, very dense. All right, so sinuses are there for resonation. So if you're hitting a solid block of wood or you're hitting something hollow, there's resonance. It makes the sound different. For phonation. And once again, I'm going to try to transluminate this. All right, so I'm going to look at how thin these portions are. Maybe I can, sorry guys, I just don't have anything set up here. So just realize how thin or wisp, they're like almost as thin as tissue paper. So mastoiditis, not like mastitis like cows get, mastoiditis. So mastoid and itis means inflammation. Can develop in the middle ear, and the infection, it can spread very easily into the brain because it's so thin. If it breaks through that, if something's inflamed, realize too, there's going to be inflammation and swelling. If it's in the area or tissue or something that's thin and active, it can break through the bone, and then we get into the cerebrospinal fluid. If it gets past the meninge separation, and can cause major systemic issues in the central nervous system, which is never a good thing. I don't know what I'm doing here. Good grief. All right, sphenoid bone is complex. It's bat-shaped bone. All right. So there's the deal. Sphenoid sinuses are found within the bone of the sinus. The body also articulates to the sella turcica. It includes the hypophyseal fossa and encloses the pituitary gland. Right, so I'll try to do this. So there is your sella turcica. Right, and that's where your pituitary gland sits. Right. Remember I said this is actually literally posterior to the glabella or your third eye. So in ancient times, they would say your third eye is directly connected to your pineal gland, and that can produce DMT, and you know, can get into all the specifics of that at another time. All right, so when you're looking at this, just kind of look, and there's a greater wing and lesser wing in the pterygoid process. All right, so what's the attachment going to be? What's that for? Just start thinking about that. This contains your optic canals, allows passage of the optic nerves, cranial nerve 2, goes right to your retina. All right, so if you're going in for an eye exam and they're doing intraocular pressures, they want to check that pressure inside your eye, because you have pressure pushing against cranial nerve 2, there's no signs or symptoms with that, right? So if it's pushing, compressing cranial nerve and starts dying, all right, so it start destroying the optic nerve, and it'll start destroying part of the back of the retina, and then that's where all the photoreceptors are. can cause major blindness. And once again, there's really generally never any pain with that. You might see some flashing lights or things like that, but these are things you want to check. We want to look for that cupping of the retina, the back of the eye. Superior orbital fissure, cranial nerve passage, superior orbital fissure. And I'm pretty sure I put the this pipe cleaner through that. All right. Foramen rotundum and foramen ovale, also passageways for cranial nerves. And when we start talking about the heart, there's also a foramen ovale in embryology, so that the right and left atrium, blood passes through there, because remember, the infant, the heart is not beating, so we just want to circulate mom's blood through the fetus, all right? And there's a hole there, foramen ovale, it's supposed to be there. But as when the child's born in infancy, we want that to seal up. We want the atrium completely separate. So sometimes you can have a patent foramen ovale. So they're born with that hole in there. We'll talk about that later. So you'll see this word again when you're talking about the septum, atrial septum in the heart. Foramen spinosum is opening for arteries. Right. And there it is. There's the sphenoid bone. Just look like a bat. So greater, lesser, pterygoid process. Just kind of figure out what's there. And, you know, if they say, you know, where is a telecerca or celaturcica sit? And, oh, well, I remember it was in that bat bone. Oh, wait, sphenoid. Ethmoid, and we've all probably heard of ethmoid sinuses, or if you haven't, you have now. Superior part formed by the pair of cruciform plates that also form the roof of the nasal cavity and the floor of the anterior cranial fossa. So I mean, like, okay, what are they saying here? Superior part paired by the cruciform plates, it also forms the roof. Just think, well, here's the nose, all right? So I'm gonna say, oh, it's gonna be somewhere in this area, all right? Cristogale, a triangular process that is a point of attachment to the brain's dura mater covering. And I said earlier, a few minutes ago, remember your dura mater is attached to your brain. Right? Because there's fluid moving around. We just need some kind of anchoring point so it doesn't start shifting. Right? You wouldn't think of that, but just realize if things aren't attached, they'll start shifting. It's very similar to the pericardial sac around your heart. Right, is literally attached to your diaphragm because your heart's beating constantly. So if it wasn't, it would start bouncing all over your thoracic cavity. You ever played something called like tetherball? Right, so the heart would be bouncing all over. We need to attach that inferiorly to the diaphragm. All right, the perpendicular plate. So remember, perpendicular. Right, so perpendicular forms superior part of the nasal septum, is flanked by the lateral. So this is perpendicular here. Lateral is going to be on either side, right? Contain the ethmoid air sinuses. All right, the lateral masses extend medially to form the superior middle and nasal conchae. So just, you know, look in your book and realize what's going on in here. All right, there's going to be sinuses up in here. All right, and if any of you have ever had sinus infection or known someone with a sinus infection, it can be very, very painful. It's going to be located to be frontal, ethmoid. In here, these sinuses can fill with fluid. All right, and there's a lot of pressure. So there's the ethmoid bone. Extremely complicated, but look at how thin that is, all right? And just realize, well, what's going on in the ethmoid bone? Well, that looks kind of like the middle of your face. So it would be where your sinuses are, and there's conchae in here, lateral masses would be here, lateral. You guys know directional terms, right? Orbital plate. All right, because your nose is here, the orbit's up here, so you're figuring, well, your eyes are going to be in here somewhere. All right, and here's your cristogale. Remember the dura mater attaches here. All right, but if you've ever seen some of these violent movies I don't like to watch, but if you break someone's nose and shove this portion up right into the brain, or if you hit it just right, you're shoving this right up into the brain. All right, can cause instantaneous death. All right, and there's another anterior view. Right. You guys can study this however you want. When I was in grad school, I had a CD called Netter. You could go in and you could blank things. Netter, it's by Netter, N-E-T-T-E-R. Fantastic artist and MD. But I could go in and I could get a picture of this and I could blank these all out, go in and type it, and it would tell me if I was right or wrong. And I did it continuously. Or I would make copies and I would cover it all up and then I write it all out and check myself over and over again. And I'd always, there'd be something I'd always forgot or couldn't get into my head. So there's another view, superior to inferior. So just kind of, when you're doing this, get your orientation, anterior, posterior, and start learning or start thinking, well, I haven't learned the brain yet, but this is the frontal area, this is posterior, this is lateral, medial, I know the ears are over here, sinuses is here, eyes are here. Just start orienting yourself to what's going on. Don't just look at this picture and try to memorize that. I mean, you could try that. I wouldn't be my method, but we all learn differently, right? All right, sutural bones. So sutures, like if you're talking about surgery, we're going to stitch someone up with sutures, all right? But sutural bones here, this is probably the best. It's helps from its orders. I don't really know. I guess the camera's up here. All right, so there's sutures in there. You can see, you'll see pictures of it coming up. Tiny irregular shape, bones that appear within sutures, significance is unknown, as not everybody has these. All right. These literally, from the foramen fontanelle. All right, if the baby, the soft spot, I do have a real baby skull here, but I don't want to go pull it out as it's getting really brittle. You know, a baby has the fontanelle. It's a very soft spot in the brain. So as that starts filling in, these sutures will start coming together. Right? They're saying significance is unknown, as not everybody has these, but there's something called cranial sacral technique, and sometimes they can go in and they can, it's a little bit esoteric, but they can go in and manipulate these sutures and get them moving again, right? And get that cerebrospinal fluid moving over. So the significance of these, really, they're like seismic plates or things, Senator's fault lines. There's things that they can start regulating pressure and regulate movement. Right, so here's a sagittal suture. There's your lambdoidal suture again, caused by the shape. All right, lambda, occipital bone, superior nuchal line, inferior, and just remember these are their attachment sites for ligaments and muscles of the neck and the part of the neck there. So the facial bones, there's a mandible, right? So you guys should know that, the lower part of your jaw. Maxillary bone, right? Maxillary is up in here, that portion where your teeth are. Zygomatic bones, remember they're going to be over here. Nasal bone, lacrimal bone. So think about lacrimal. So just start thinking tears. So where do you think those would be located? Palatine bones, all right. A Balmer in the central part of the nose, inferior nasal conchae. There's two of those. So the mandible is the strongest bone of the face. All right, and if you don't believe that, just think of somebody who's having a seizure. They have lockjaw. So sometimes when people have a seizure, those muscles contract so hard they can fracture the mandible, and they can actually crack the teeth. All right, that's how strong this bone of the face is. U-shaped lower jawbone made of upper body. All right, it's kind of U-shaped. Two upright members. So the mandible, so temporal mandibular joint, mandible is the point where the rami and chin meet. All right, there's a coronoid process. All right, so the superior end of the rami serves as an insertion point for large temporalis muscle. Remember, this temporalis is over here. And just not to confuse you, but there's a coronoid process here, and there's a coracoid process in the scapula. All right, so try not to get those two mixed up. The condylar process is posterior to the coronoid, forms part of the temporomandibular joint. Right? Body consists of the alveolar process. Right? Maybe I can show you one on here. All right. Show you this in here, hopefully. And there, I got a. All right, I've got a pipe cleaner in that alveolar process that contains sockets for teeth in the mandibular symphysis ridge. All right, and the alveolar process, these are actually a specific type of a joint called the gomphosis. I've seen that question quite a bit. Some random fact that I expect you guys to remember. But anyway, foramina include mandibular for nerves and the mental foramen for nerves and blood vessels. So just learn those points. There's going to be foramina for nerves, the mental foramina for nerves and blood vessels. All right. So here's a mental foramen. Right. And these are lateral. All right. So there's some of the condylar process here. The rami is that little arch area, right, mandibular angle. All right, your jawbone. You can say, you know, somebody has a really, really distinct jawbone. All right, they're talking about the mandible. All right, the maxillary or the upper portion immediately fused to form the upper jaw and central facial skeleton. All right, and just the other thing too, think about this. Try to do this too. Try to translate this. So any of you that are going into, you know, dental or whatever, just realize that the sinuses are above this in here. We just learned about that too. So if you're going to have some kind of a titanium implant, or you need something done, or a root canal, just realize that those are really, really, really close to the sinuses. So sometimes you go to have one of these upper teeth replaced with a titanium post or an implant. Sometimes they have to literally go in and they have to build up the bone area. So they might go in and, remember we talked about osteoblasts and osteoclasts and all this stuff. So they can actually, they'll go in and it's really kind of cool. They'll pull growth factor from your blood, right? And they'll go in, they can pack it with osteocytes, or they can use, not to be gross, but they can use sterilized cadaver bone. So you have the components there, and they can have you build up that bone area. So when they go to put the titanium post in, they have something to anchor it to. Side note, right? So this anterior postal spine forms just below the nose. So just kind of think of, you know, you're in here on the maxillary bone. So start visualizing, you know, either from here or what view you need to do. And a lot of you can go out, you can get 3D animations of this stuff too. Stuff that was not available for me when I was taking this. Right, there's a frontal process. So realize, well, I know what the frontal bone is. I know anterior from posterior. To give you an idea of where that is located. Zygomatic process. All right, so there's zygomatic. All right, and there's a maxillary. So I would say it's going to be somewhere over in that area, right? Right. Openings for nerve and blood vessels, and we'll see a picture of that from the, we'll be viewing it from inferior to superior on the palate. And there you'll start looking and seeing some of these openings. All right. Inferior orbital fissure, that should be easy to figure out. Infraorbital foramen, and then incisive fossa and canal. So where are your incisors? Think about that for a second, right? Shows the infraorbital foramen, right? Here's the orbital surface. So just think, well, wait a minute, that's where the eye's going to be, right? The eye's going to be there. All right, this articulates with the frontal bone. There's your frontal sinuses. And a lot of times if you, like I said, if you have somebody or know somebody or you suffer from sinus infections when the weather changes, or you get some kind of bacterial infection in your upper respiratory tract, this can be very, very painful. Right? And I used to work with a woman who would literally, she'd have hot coffee on her forehead or on the side of her face whenever she had a sinus infection. Loosen it up, I guess, she told me. All right, zygomatic bones. These form the cheekbones and inferior margins of the orbits. And I said, well, where was the zygomatic arch? So we're going to be talking about the zygomatic in this area here. All right. Nasal bones, they form the bridge of your nose. And we all know by ethnicity that they're all generally a little bit different. All right, not any of us have the same exact nose structure. Very, very unique. Ears are very, very different. And you know, the other really cool thing, if you look at pictures of people from when they're children to adults, you'll look, their ears are completely different, their nose is completely different. So, you know, we're thinking, well, did the bone really remodel? Because we said before that during, the writing reflex, yeah, was the, for the eyes on the horizon. According to Wolff's law, your bones are going to remodel every 7 years. So you realize that your osteoblasts and osteoclasts are remodeling all that. But sometimes they can change in shape depending on, your bones can change in shape depending on what kind of shearing forces are put on them. And the cartilage in your ear can change too. It starts to ossify as you get older, so it can change some of these things. And you'll notice, if you look at people as they get older, you know, think, well, did their ears really get bigger, or did everything around it get smaller? So just start thinking about that. So that was a side note. I lost my train of thought. All right, so nasal bones form the bridge of your nose, articulate with the frontal, maxillary, and ethmoid bones. So like I said again, when you're looking at these or picturing this, what are they articulating with? What are the boundaries? So think of it as like a state. I said, what other states or what other landmarks are surrounding that bone? Right. So attached to cartilage that forms the tip of the nose. All right, so you know it should be relatively flexible. Right. Lacrimal bones forms the medial walls of the orbits. So lacrimal, I said lacrimal, you know, tears are lacrimal fluid. Articulate with the frontal, maxillary, and ethmoid bones. Lacrimal fossa that houses a lacrimal sac allows passage for tears to drain. And if you don't believe me, if you've ever seen somebody cry, or you've ever cried for something, tears of joy or happiness or anger or whatever, it's draining somewhere, right? So it's draining right into your nose or into the mouth if you're really, really crying. You know, there's all those things called punctate in the eyes that drain some of the tears, and somebody has dry eye that can actually go in and block those. They can put little silicone or wax plugs in there. As people get older, their eyes get dry, they can go in and they start blocking that drainage. So it keeps the tears on the cornea. All right, so there's a side view showing you all the bones, and just start thinking, you know, I know it's hard and it's a lot, but start thinking about 3D structures, or what is deep to that, or what is, that's the outside wall, so what's behind it. Right. Palatine bone, L-shaped bone, made from two bony plates. These are actually plates. There's a horizontal plate. Remember, horizontal is always this direction. Posterior, 1/3 of the hard palate. All right, so palate, that means it's my mouth. Or the hard palate would be, probably the back, right? It's the part where your tongue actually can't reach all the way back. Right? The perpendicular plate forms part of the posterior lateral. So posterior lateral, giving you the orientation right there. Walls of the nasal cavity and small parts of the orbit. So just realize that, you know, a small part of the orbit is back here. It's gonna make a small portion of that. The vulnar is a plow-shaped bone, forms part of the nasal septum. All right, so there's that vulnar. You kind of look, it's plow-shaped, all right? And there's that palatine bone, the horizontal plate. All right, remember, perpendicular is going to be going in this orientation. All right, so just start thinking through here, like what will horizontal would be going this way, perpendicular is going this way, and there's your orientation. You're doing a sagittal cut right there. All right, so the inferior nasal conchae. So conchae are going to be, think of those conch shells. You know, you're supposed to hear the ocean in them. So that's how they kind of got their name, by that shape. Pair of bones that form part of the lateral walls of the nasal cavity. Largest of three bones of the conchae. The ethmoid bone forms the other two pairs. So when you're looking at the ethmoid bone or that area, start orientating yourself to that. All right. The hyoid bone. So this is one bone, is there for part of your tongue muscles to attach to. All right, it's free floating. It's the only bone in the body that doesn't attach to it doesn't articulate with any other bone. All right, lies in the anterior neck, inferior to the mandible. It's not a bone of the skull. It's just kind of sitting there free formed. It's kind of U-shaped. Only bone that does not articulate directly with another bone. It's anchored by ligaments. All right, so ligaments anchor bone to bone. They don't actually attach, but they're attached by ligaments. Act as a movable base for the tongue and site of attachment for muscles for swallowing and speech. So it's just going to free floating there with ligaments and muscles attached to it, so they have something to pull against, right? And this is the bone that gets broken if someone is strangled. Right? Somebody's strangled, they go in and actually crush that bone. All right, so if you look where it is, lesser horn, greater horn. So this is going to be where the ligaments are attaching. So we have something stable. So when the tongue muscles contract, they have something to hold on to. So we have some shearing forces. Right. So the orbits are cavities that encase the eyes and lacrimal glands. Lacrimal glands, once again, these are what's going to make your tears. Sites of attachment for eye muscles. Right. And we'll talk about the muscle later, and superior lateral and eyes that are medial lateral or lateral rectus, or these muscles that actually cause the eyes to move back and forth. And then one's going to be on this little pulley, and we'll see that. Sites of attachment for eye muscles formed by parts of 7 bones, and there's the 7 bones there. So you could go in and look at your, go in and look at the colored pictures, and you'll see all the different colors in there, and that all these bones articulate and they form the orbit. I certainly would never ask you guys that. That's crazy, but if you look, that is a fact. That's what it would look like in the real skull. This totally does remind me of Ahmed. So, so there's an actual close-up, right? And there's all the different bones, all right? But just, like I said, when you're going and looking at this, I know it's going to take a little more time, but repetition is the key. Once again, optic canal, well, what's going through there? Superior orbital fissure. Well, why would I need this great big area, my spine, posterior to my eye? What's going through there? What's coming through the infraorbital foramen? Well, what's located in that area? Is that going to be a nerve? Is it going to be blood? In the nasal cavity, formed by parts of several bones. So when you're going in, you're looking like the nasal cavity in here, posterior. And so, you know, what is the roof, the portion? Well, there's the nose. So if I were to go in through here, what am I, I'm up against, sorry, I'm up against something up in here. So there's a lateral view of what's going on here. Okay. Yeah, lateral walls are superior middle concha of the ethmoid, perpendicular plates. Right. Spaces between the concha are called meatises. Right. A meatus is always a space, a fissure, foramen, you know, all of these spaces, and they're not there for no reason. Right. So conchae increase the turbulence of the airflow. Right. The floor is processed of the palatine and maxillary bones, the floor in your sinuses. The nasal septum, that portion that divides it from left to right, and I'm sure you've all heard of people with a deviated septum. All right, so if somebody has a deviated septum, they usually have trouble breathing, or their voice sounds a little weird. Or a big problem with that is they'll go to sleep laying on their side, and then one side of their sinuses will get all plugged up and they have to flip over, and the other side will drain, and then the other side gets plugged up. It's a constant battle back and forth where all this fluid goes in the sinuses if they're deviating, causing major, major problems with pressure gradients and all kinds of crazy stuff. So anterior formed by the septal cartilage. Remember, cartilage is rigid, but it is a little bit pliable. Right? So when they go and do the nasal surgery, or they used to, they would go in, and sometimes they have to break it completely, and they shove these molds up in there, and they can literally sew them together, and then it can be weeks or months when it re-heals. We reconstruct that sinus or that lumen, right, so that people have a much easier way of breathing. Paranasal. So para usually means around or side of, formed by 5 skull bones. Right, all contain, there's the key, they all contain mucus-lined air-filled spaces. Right? So anything that's external to your body, any part of your body that is in contact with the external environment, and your nose is, because you're breathing in external air. These are mucus-lined. Right? So we want mucus there. Remember too, anything that's mucus lined usually has IgA, immunoglobulin A antibodies in it. Very, very important. Right? Functions warms and humidifies the air. Just think about that. What if you were outside, you know, specifically in Buffalo in February, and it was 10 below zero, and you breathed in really quick, and there was nothing to warm that air. By the time it got to your alveoli in your lungs, it could potentially freeze the alveoli, all right, and they would die. They'd really be dead, and it wouldn't regenerate very well. It helped to lighten the skull. We want that solid bone there, and enhance resonance of voice. Right? So when your sinuses get plugged or full of fluid, your voice changes, and you all know when you have a cold, your voice changes. That's just from swelling of the nasal cavities. The mucus line cavities can swell and change the, they swell, and it diminishes the room and the lumen. Right. So there's your maxillary sinuses, there's your ethmoid sinuses, right? And these can be painful too. Right? And then the frontal sinuses. Right? So I think I can do that. Maybe. I can eliminate, eliminate them. But you can, if you suspect somebody has a sinus infection or it's fluid, you can turn the lights off somewhere, and you can actually go up and you can transilluminate. these sinuses and see what's going on with the patient. All right, guys, I'm going to end that for today. So that was probably like an hour and a half. I guess what I'm going to do is I'm going to just start making more and more of these. It's just easier if I do it here at school. I have the models I've been doing at 6:30 at night on Mondays. I will check in with everyone, or if you need to Zoom meeting with me, we can do it whenever you want, or I can check in with you guys quickly on Mondays at 6:30 if you want. So just let me know. I think my thought process right now is the holidays are coming up. We just had a traumatic week. I'm sure you all hopefully, we're going to deal with whatever this situation is. However, it came out. So let's get back to work. And A&P1 literally is probably one of the hardest courses you'll take because there's a tremendous amount of information. Use whatever resource you have. Google. You all have a mastering, tremendous resource. You've got those worksheets. I know you have to put them out. I can't give them to you, unfortunately. Just go in and figure them out. So the information should be in your book, and if it's matching or whatever, process of elimination. So just start getting in that thought process of doing it. And I know it's not fun, but just remember, if you're resistant to something, it's really just your subconsciously, your unwillingness to expand, right, or get better at something. So whenever you have resistance, that's just your ego or whatever, just showing you your unwillingness, or you're not volitionally want to expand. All right, those are my words of wisdom for today. All right, let me end this here, and I will throw it up on back.